From here, we move on to the topic of patient etiquette. And in this section, we'll discuss things you might come across when caring for Muslim patients, from understanding the hijab to general issues of interaction. We'll start with appearance. The first point of interaction between healthcare workers and the patient is often visual, and it's common for Muslim female patients to wear a hijab, the same way it's common for Muslim males to have a beard. Of course, this isn't always the case, and we'll emphasize that a little more in the next slide. Let's start by defining some terms. Hijab. Hijab generally refers to the head covering that Muslim women wear. Depending on the part of the world a person is from, hijab can look different. A woman might wear it as a turban or as a loose shawl over her head, or the way you see me wearing it. And it's important to note that hijab also includes covering the body. You'll find that throughout the presentation, we emphasize modesty and patient exposure during medical care. So it's important to understand that hijab encompasses more than just a head covering, and that includes the body as well. We'll pause for a moment here to explain hijab with a little more detail. Hijab is a religious commandment for Muslim women, and wearing the hijab is an expression of obedience to God. For many women, it symbolizes modesty. Even though hijab is a religious commandment, women have free will to decide whether or not they will cover. In cultures where this free will isn't allowed, it's important to know that those actions are culturally enforced and that they're not supported by religious teaching. When a Muslim woman starts wearing hijab, she'll cover in front of males who aren't related to her. So she won't have to cover in front of her husband, her father, brothers, or sons, but outside of her nuclear family, she'll cover her hair and body. And that includes, of course, in front of men in the healthcare world, assuming that they don't fit into the family criteria that I just mentioned. Also, note that women don't have to cover in front of other women, so the situation is different for female doctors, nurses, chaplains, techs, food service workers, etc. All right, now back to our discussion on hijab. Let's talk about the niqab. Niqab is the face veil that some women choose to wear. Some women wear it as part of their interpretation of hijab or for additional piety. For others, it may be purely cultural and not religious. You'll find that niqab is more prevalent in some parts of the world, but largely it's viewed as an extra expression of modesty. A reflection point here: given our Western ideals of freedom and female liberation, it's important to be careful not to impose our personal ideals on someone else's choice to cover their hair, their body, or their face. It may be a unique perspective to hear, but for many Muslim women, hijab is incredibly liberating and represents all sorts of personal and social freedoms. There are lots of resources online that delve deeper into this topic, but for now, there's just one more point I'd like to make on hijab, and that is, keep in mind that not everyone wears hijab or covers their hair. Many Muslim women do not wear hijab at all, but still, they may share the same cultural and religious preferences for modesty and privacy. So if you know that a female patient is Muslim, the best thing to do is ask her about any preferences she may have. Moving along to the male world, you might notice that some of your Muslim male patients have a beard. It could be a short beard or a very long beard. For Muslim men, keeping a beard is a religious recommendation that a lot of men uphold. It's based on prophetic tradition, and because of that, it holds a lot of religious significance for many people. And just like hijab, not all Muslim men keep a beard, of course. It's an important point of consideration, though, for patients who do, because it's part of their religious identity. And finally, looping in the beard to the conversation on hijab, our final point touches on our earlier conversation about implicit and explicit bias. The truth is, many people pass judgment based on physical attributes, like the beard and the hijab, and sometimes it's subconscious. So please remember to reflect on these issues and work toward gaining a better understanding of the person in front of you. Moving along, with regards to hijab and accommodations, healthcare workers should always prioritize a Muslim patient's request to wear hijab while receiving medical care, unless a medical emergency necessitates otherwise. This is from a New York Times article on respecting Muslim patients' needs. The article tells the story of a Muslim lady who went to a physician whom she trusted and told him, I need to at least have my head covering on when I leave the operating room. When she woke up, she was wearing a gown, but her head was uncovered. She was livid. She had been there many hours. She will never go back to that hospital again. This really speaks to the fact that sometimes, even if a preference is communicated, it's not respected. And we understand that at times those requests aren't honored due to medical circumstances, and then it's understandable, of course. But other times, it's simply a lack of accepting the importance of a particular request. And to that, we emphasize that it's really critical to respect a person's wishes and to be culturally sensitive to their preferences, whether or not it makes sense to us and whether or not it aligns with our personal beliefs. In this presentation, you'll hear us discuss religious practices that align with what you'd call Orthodox Muslim culture, referring to Muslims who follow the faith in a more traditional, conservative form. It's important to understand this when discussing modesty and interactions between men and women. We've mentioned already that Muslims are not a monolith and that as a global religion, there are so many different practices. The next few slides are based on the perspective of a more traditional or orthodox practice of Islam. As a healthcare worker, you might encounter this heightened sense of modesty from male or female patients, especially when it comes to issues related to uncovering private areas. For example, one nurse made the following observation. I remember once when a female Muslim patient did not let a male paramedic remove the urinary catheter. She also didn't let me look at her wound dressing because there was a male paramedic in the room at the same time. That happened to me twice or three times with Muslim women. Now, we've already said that medical necessity overrides religious rules, but when there isn't a medical emergency, then a patient's religious preference should be considered and respected. There are other areas of patient etiquette that go beyond the physical aspects of covering, but still qualify as expressions of modesty. Regarding patient interactions, here are some key things to consider. From an Orthodox Muslim perspective, physical interaction is not permitted between members of the opposite gender, and so you'll find that some Muslims do not shake hands with the opposite sex. In many parts of the world, and in America, we know that a handshake is a gesture of greeting and respect, but there are religious guidelines around physical interactions that some Muslims follow strictly. So remember that if a person from the opposite gender isn't comfortable shaking your hand, it's not meant to be offensive, even though it's often awkward for both people. The first advice we have is that if you're in this situation, know that it's nothing personal. And secondly, one thing we suggest that might help avoid an awkward moment is to consider allowing the patient or the patient's family to extend their hand out first, because of course, some Muslims do shake hands, and it may be easiest to let them guide that process. Alternately, in many Muslim majority cultures, people put their hand over their heart while they greet someone. It's a really common practice, and it's understood as a gesture of respect while maintaining physical space. With regards to hugging, sometimes hugging is a natural response to certain moments during times of extreme happiness or times of grief. Consider asking a patient if it's okay to hug them. They'll very likely understand the intent behind your question and even appreciate the consideration. Finally, let's talk a little bit about eye contact. If you've dealt with Muslim patients or their family members before, and this is especially true for immigrant families, you may have noticed that some patients look down and lower their gaze when they're speaking with a member of the opposite sex. Again, this isn't always going to be the case, but if you do come across it, here's why. Religiously, lowering one's gaze when speaking to someone of the opposite sex is an expression of modesty, and it's also meant to show respect to the person you're talking to. Of course, comparing that to the American concept of maintaining eye contact and the notion that if you don't look someone in the eye when you talk to them, it's disrespectful, it can make things really confusing, and it can easily be misunderstood based on the American social construct. So just remember that when you're assessing social behavior, eye contact avoidance should be understood in the context of modesty and respect. From here, we just want to make this important point, and that is that while more Orthodox Muslim women are inclined to express modesty in the ways we discussed, many men also follow the same rules of modesty in their behavior and in social etiquette. So, now in understanding how to best apply patient etiquette, we recommend these basic accommodations. Whether the patient is male or female, if possible, try to provide a same sex healthcare worker to care for the patient. And where possible, demonstrate these points of cultural competency when you're interacting with patients. In terms of considerations, do not remove a lady's hijab unless it's medically necessary. And if you need to completely expose a patient, male or female, only expose what's needed of the body, preferably in sections, and only expose the body for as long as is needed, and then cover the patient up as soon as that need has passed. Additionally, don't shave a Muslim man's beard unless it's medically necessary, and if possible, make sure you discuss that with the patient beforehand. And finally, to offer privacy, it's a great practice to put a sign on a patient's door that says knock, announce, and pause before entering. That way, if someone isn't properly covered, they can quickly get dressed. It usually takes just a minute or less, but it's a very respectful gesture and a very sensitive expression of cultural competency. On behalf of CAIR-Florida and the Hospice and Palliative Nurses Foundation, thank you very much for joining us.